Hello and welcome to the Joint Commission Resources Quality and Safety Network Accreditation Update. I'm your host, Gael Garbarino. Created in 2008, the Joint Commission Center for Transforming Healthcare aims to solve healthcare's most critical safety and quality problems. The center's participants, some of the nation's leading hospitals and health systems, use a systematic approach to analyze specific breakdowns in care and discover their underlying causes to develop targeted solutions that solve these complex problems. In keeping with its objective to transform healthcare into a high-reliability industry, the Joint Commission shares these proven effective solutions with the nearly 21,000 healthcare organizations it accredits and certifies. Let's take a look.
My sister-in-law, when she gave birth to her first son, she initially came home uncomplicated. Everything was fine. She went home with the baby. 2 weeks later, she gets admitted to the hospital.
Typically, when an individual goes into a hospital or gets any care, wherever it might be, typically they might be at their most vulnerable position.
You never know where your family or loved one's going to end up, and the last thing that you want is to be sitting up there wishing and hoping that they didn't necessarily end up at the wrong institution.
It's not numbers, it's not data, it's not analysis, it's one patient.
Healthcare is a phenomenally complex and dangerous industry. Not because people don't care, because it is so complex and it depends on human beings.
It's not enough just to do great clinical work, but you also have to make certain your processes are safe enough so that you can achieve the objectives that you want by having that great clinical work.
It's difficult to get something that you can improve in one location spread to all other locations. So it's not unique to the center. This is a healthcare problem.
You would think that, they were easy to do. You would think that the process is easy to carry out, but it's not. It is such a culture shift.
The work of the Joint Commission Center for Transforming Healthcare is really to transform the healthcare industry into a high reliability industry. And to do that, we need leadership, an effective safety culture, and robust process improvement methods.
The Leadership Advisory Council is an important part of the Center for Transforming Healthcare. It provides a unique opportunity to bring three groups together that don't ordinarily get together and collaborate. Leaders from industry, leadership from the center's hospitals, and the process improvement experts from the Center for Transforming Healthcare.
The center does a terrific job of sharing best practices, making sure that what they've learned, what the participating hospitals have learned in their project, they share and provide tools so that their entire network of hospitals have access to those solutions.
It's really driving a collaborative effort. It's not one institution at a time, it's not one provider at a time. It's going across institutions, picking common themes.
For many, improving safety or quality is a broad concept, and really what the center does is it breaks it down into the very specific components that, if implemented, can truly deliver outstanding outcomes.
It's about a way of life for leadership in hospitals that we need to adopt.
Go down to the patient's level, and patients will appreciate it. And patients would want to come to a hospital that has a lower mortality.
It's much more powerful when you start looking at the names of the people. And we can't find the names of the people we saved, because we don't know if they would have been saved or not. But we can certainly find the names of the people who died.
It could be your father, your brother, your sister, and this work will impact them.
Now stay tuned for today's JCR QSN program.